According to the CDC, the overall burden of influenza or the flu for 2019 and 2020 was an estimated 35 million flu-related illnesses, 16 million flu-related medical visits, 380 flu-related hospitalizations, and 20,000 flu-related deaths. This means a little over 10% of the entire United States contracted the flu during this time.
The flu can also be deadly for many people, including patients over 65 years old and people with chronic health conditions. It can also, in rare cases, do permanent damage to your lungs. And much like COVID-19, it spreads primarily through respiratory droplets.
From our interviews with healthcare professionals, the best way to prevent the spread of the flu is to get vaccinated, wash your hands, and wear a mask. But what if these methods fail and you do get infected with the flu?
While there is no cure for the flu, you can treat the symptoms easily with rest, fluids, and anti-fever medications. You can also take Tamiflu, an antiviral that must be administered in the first few days and must be prescribed by a doctor.
The problem is, you may not have someone to take you to the doctor. Or maybe you don't want to go out and infect anyone, as flu transmission is the highest in the first 3 to 4 days after the onset of the illness. What if you live in a remote rural area with a little access to healthcare? Or what if you just need the peace of mind of knowing whether you actually have the flu?
Our solution is a cheap, at-home test that allows for a quick and accurate diagnosis of the flu. Our solution requires no in-person doctor's visit and gets results in minutes, so you can be prescribed Tamiflu from the comfort of your home. Or if you want peace of mind and want to prevent the spread of the flu to your family or your coworkers, you can buy one to diagnose yourself and take necessary steps to prevent the spread, such as remaining at home and wearing a mask.
Currently, the only options are tests that cost hundreds of dollars, or if you have no insurance, expensive doctor's visits. Our solution aims to match the price point of similar tests, like at-home COVID tests, at around $20 for 2 tests.
Our test would be a rapid antigen test and would require a small sample from your nose that's mixed with a buffer solution and dropped into a small cartridge filled with coded antibodies that react with any flu in your sample to give you a visual diagnosis.
With a quick swab of the nose, you can protect yourself, your loved ones, and your fellow citizens, all from the safety of your home. Thank you for your consideration.